Today we're going to start a very important topic, which is actually geographic tongue. You can see that this is a geographic tongue of the patient. Okay, so you can see the erythematous areas. Erythematous areas, you can see actually basically this is the erythematous areas, or either it can be a scalloped. They are the scallop borders with well demarcated erythematous zones. Okay, the patient can have fissure tongue, you can see here, and also glossitis with this patient can, you can see it. Okay, okay, now moving towards, so let's start. Bismillahirrahmanirrahim. Okay, so basically what happens, it is also called geographic tongue. Geographic because you can see that the appearance of a tongue is like a geography. It is a benign migratory glossitis, which I have told you. Inflammation is also present. Wandering rash of tongue means you will say there are patches of rash. So patient thinks, what is this? Wonder. Benign condition and affects more the females than men, and the pathogenesis is unknown to her. The patient is asymptomatic, and basically usually lingual mucosa is sensitive to spicy foods when the lesion is present or active. Present in two-thirds of the dorsal of tongue. But multiple, you have seen there are multiple well demarcated zones of erythema present on the tips or lateral borders of the tongue. But in that part was the hairy tongue was present in the midline of tongue interior to circumvallate papilla, leaving the lateral and interior borders. And the erythema is due to atrophy of filiform papilla. In that what happens, the filiform papilla was hypertrophic. Okay, so what they are saying that the erythematous areas but surrounded at least partially or slightly elevated yellow white serpentine or scallop borders the patient will have. It is benign small white patch have a central erythematous atrophic zones in largest centrifugal link. Patient having also a fissure tongue, you will see along with it, and present on buccal mucosa, labial mucosa, buccal, labial, and mucosa and soft palate. Tongue is always involved. Okay. Acha, hyperkeratosis because the keratin is depositing. Spongiosis is basically intracellular edema. Ecnotosis is the, of course, the edema of the spinous layer and elongation of fatty ridges. So basically it is the finger-like projections of connective tissue. What happens there are Monroe abscess. Monroe abscess is basically collection of neutrophils. Neutrophils. So Monroe abscess are present lymphocytes and neutrophils involved in lamina propria. The intense neutrophilic infiltrate may also responsible for destruction of superficial portion of epithelium. So basically they are saying that there are so much neutrophils that they destroy the superficial layer of the epithelium. You have seen that this is the erythematous patches with the well demarcated zones and also with the scallop borders. Okay, you can see the glossitis, fissure tongue. Okay, so benign condition, you don't need to treat it. Reassurance the patient because about it is benign, and you will be fine. So you have to basically make understand the patient about the disease. Okay, in cases of tenderness means, okay, tender means pain on touch or burning sensation. So topical steroids like fluoxetine or betamethasone gel applied as thin films for um, basically 3 times for 2 weeks. So you will have a fluoxetine or betamethasone gel that you will apply 3 times for 2 weeks. Okay, so basically, okay, fluoxetine, yeah, betamethasone gel is present for this. Okay, so with this we have finished the um, uh, erythema migraines, which is basically a geographic tongue. We have studied about that it is also known as basically the erythema migraine, geographic tongue, wandering rash of tongue, benign migratory glossitis. It is also called more common in females. The pathogenesis is uncommon basically. causative agent is unknown basically to us. The patient has glossitis with a well demarcated zones of erythema basically it has, and the patient will have a fidget tongue basically. Okay, so and it occurs basically the lingual mucosa becomes sensitive to spicy foods either due to the lesion which is already present, it is present on the tip of the tongue or on the lateral borders of the tongue. Now moving to nicotine stomatitis. Nicotine stomatitis, or also called it nicotine platanis or smoker's palate. Basically, it occurs in the smokers actually. It is basically a white keratotic change of palatal mucosa. Your palate has a white keratotic change associated with tobacco smoking again. So there will be a white patch on the palate due to smoking. It does not appear to have a pre-malignant nature because it may be produced in response to heat rather than chemicals in tobacco smoke. So they are saying that this is not a pre-malignant condition or lesion. It is basically is produced due to the heat production that is produced from the tobacco rather than the chemicals that in tobacco. So long-term use can of extremely hot beverages, or either can the patient takes very hot beverages in the form of tea, coffee, etc., water, hot water, so that's also might be a reason. A reverse smoking habit also results in palatal keratosis or reverse smoker, so the palate which has a significant potential to develop dysplasia or carcinoma. So basically it is also due to reverse smoker palate. Okay, reverse smoker palate, and then it has a potential for carcinoma. Okay, then it has when there's a reverse smoking. In reverse smoking there are clinical features, basically older than like 50 plus, palatal is more actually, palate is involved, it is diffuse gray or white, the patient will have a gray or white on the palatal area basically, and there will be many slightly elevated papules with a punched red centers. Means what happens, there will be papules will be present basically on the palate. There are actually like this papules, you will see it actually, and punched red centers, the patient will have reddish pinpoint papules. Okay, such papules represent inflamed minor salivary glands and their ductal orifice. It is because when the minor salivary glands are inflamed and their ductal orifice means their ductal opening, so they represent as a papules. Okay, so mucosa basically covers frequently appears white than the surrounding epithelium, so the mucosa will appear white then. So basically the minor salivary glands and their ductal orifice is inflamed, so they give you the appearance of the papules. Okay, which is present on palate. Like hyperkeratosis, acanthosis, and mild patchy chronic inflammation of subepithelium connective tissue and mucous glands. Of course, there are patches of chronic inflammation of subepithelium connective tissue and mucous glands. Okay, squamous metaplasia of excretory ducts means, of course, you have also studied in oral pathology that there is a metaplasia of squamous layer of excretory ducts. The squamous layer becomes metaplasia. Inflammatory exudate within the duct. Okay, you can see here. Yeah, there's a better appearance. You can see here papules. The papules are punched out and having a reddish center. Okay, you can see here punch out and will have red centers on the palatal area. Treatment is, it is completely reversible. The palate can be normalized into 1 to 2 weeks when smoking is removed. No treatment required. Any white lesion on palatal that persists after 1 month of hypercinia should be considered a true leukoplegia. So they are saying when any lesion that even it persists when you are not smoking it, so you should consider it as white patch, true leukoplegia. Okay, when you have stopped the smoking and for 1 month and still the white patch is present actually. Now moving towards the actinic cheiliosis. So basically it is actinic cheilitis. Cheilitis, it is basically when the patient is for a very long time exposed to the UV radiation. Okay, so it is also called actinic cheilitis. Basically it is a pre-malignant alternation of the lower lip vermilion zone. Okay, vermilion results from long time excessive exposure to UV or exposure flavor that I have told you. They are more common in light complex people, the people having like farmer lips or ciliar lips. Farmer lips or ciliar lips that basically are most of the time exposed to UV. Chronic sun exposure in immunocompromised patients, in outdoor occupation, light compromised complex people, or in immunocompromised patients. So basically what has it is basically 50 plus patient has means older, and it is more common in men because outdoors are mostly males. It develops slowly as the patient is not aware of the changes, he is unaware of it. The earliest clinical change is atrophy or lower lip vermilion by smooth surface and pale areas. So the patient has basically have a the basically what have the patient has actually atrophy of the lower lip, which is characterized by a by smooth surface, by smooth by smooth surface and peel areas. So the lower lip of vermilion is basically become atrophic. So when it become atrophic, so the underlying connective tissue or the blood supply is more and the underlying is exposed. So it becomes a smooth and pale areas. Okay. Acha, blurring of the migraines between vermilion zone and cutaneous portion of the lip. So what you can see, blurring of my blurring of margins of vermilion zone and cutaneous portion means that the basically we have, so what we have is basically is that the like this is the uh, vermilion zone, so the margins become blurred, like they are not proper then, or cutaneous portion of the lip. Okay, basically. So okay, as lesion progress roughly scaly areas developed on drier portions of vermilion zone. Number one was the blurring of the margins. Now there is scaling of the portion of vermilions. These scaly areas are thickened and may appear as leukoplakic lesions, especially when extended near the wet line of lip. With progression, chronic focal ulceration may also develop in one or more areas. Okay, so they have tell you about that what happens. There are smooth surface and pale areas, blurring of the margins between the vermilion zones. Then there is also a scaling of the vermilion portion. Then they are saying that leukoplakia also develops appears. There is also focal ulceration on the more areas, and the ulceration may last for months, and others suggest that it can be the early squamous cell carcinoma. Okay, so what you have studied is basically blurring of margins, scaly areas on the dry portion of the vermilion. It can be also leukoplakic when leukoplakia lesion when it extend to the near wet line, and they can have a chronic focal ulcerations. And if it lasts for months, then it is the early form of squamous cell carcinoma. Histopathology, what is actually is, there is an atrophy of the stratified squamous epithelium. So the stratified squamous epithelium become atrophic and have a keratin production, means have a parakeratosis is present. Having a varying degree of the epithelium dysplasia, a mild chronic inflammatory cells infiltrate the line. Of course, the underlying connective tissue demonstrates a band of amorphous acellular basophilic change known as solar elastosis, or a UV light induced alternation of collagen or elastic fibers. So what they are saying, that the underlying connective tissue is now looks like a band of amorphous, irregular acellular acellular basophilic change. It has a basophilic change, which is solar elastosis, or it is basically what happens, the UV light do what, it changes the collagen or elastin fibers. So amorphous acellular basophilic changes appear when patient is or solar elastosis exposed to UV. Amorphous acellular basically and basophilic change occurs. Now most important is treatment. It is irreversible, number one thing. Okay, so you can do that, either you protect the lip balm or sunscreen use. Okay, biopsy should be taken if the area is indurated, thickened and ulcer or leukoplakia, means it is hard, it is become thick and it is have ulceration. So biopsy should be taken. What are the indications for a biopsy? They have tell you here the induration, they have tell you about hardness, then they have you tell you about the thickness, and of course the ulcers or leukoplakia. In clinically several cases without obvious malignant transformation, a lip shave procedure called vermilion ectomy is performed. Vermilion means a lip shave procedure. A lip shave procedure. Alternating treatments, you can use it YAG laser ablation, electrodesiccation, and you can also use topical fluorouracil, topical amikumod, and photodynamic therapy or chemoexfoliation with the trichloric acetic acid, and long-term follow-up should be here. So the patient presents you like this, you can have it. There will be actually what there will be the smooth surfaces, scaly appearance, leukoplakia kick lesion type. Okay, the patient will have. So basically the clinical features, the patient will represent with a smooth surface, scaling you can see here basically. Okay, and yeah, and there will be also a white patch or leukoplakic changes. Actually focal ulceration will be also present, you can see focal ulceration. Okay, thank you. If you have any query you can ask in comment section. So we have discussed about geographic tongue, actinic cheilitis we have also discussed. Okay, then we have also discussed nicotine stomatitis. Thank you.